Hi, everyone. So I'm representing the perioperative specialty. So I'm the program head for the perioperative specialty here. And I'll just go on to the next slide. So for those that are not familiar with what perioperative is, it's basically the operating room. So we educate perioperative nurses who are involved in surgery. And some of the surgeries that you may have had or have heard of are like C-sections, cesarean sections, knee scopes, gallbladder removals, and so forth. And then so one of the most rewarding things about being an operating room nurse is that you are able to like fix a problem and ultimately giving the person and the patient, the client that you're caring for, a better quality of life. Well, many people assume that perioperative nurses don't have much patient interaction and that there's no direct patient care. We do, however, provide patient care. It just looks different. So we provide patient care in two main roles. So one is called the scrub nurse role and the other one is called the circulating nurse role. The scrub nurse role is probably what you're more familiar with seeing on TV, being as part of the sterile team member, working with the surgeon, handing the instruments and so forth. The other role, the circulating nurse role, is the one that if you had surgery, you may know that they are the ones that check you in, bring you into the operating room and set you up, make sure that you are safe and ready to go for the surgery. And essentially both roles are advocating for the patient's safety and best care as possible. And they're caring for the patients in their most vulnerable times. And then, so who is our program for? So we offer just a few pathways. Kathy mentioned that we offer this for RNs, as well as BSNs, and then also LPNs who wants to advance and work in the operating room. And also perinatal nurses is our kind of third modified pathway, you could say. These are for perinatal nurses who would like to participate in cesarean sections. So both in the scrub and nurse role for cesarean sections only. And this is just a little overview of what our program looks like. It's a total of 25 credits. And you can see on the slide there that it's divided into 3 theory courses and 3 clinical courses. And so 7-100 is your foundational intro to perioperative nursing course. And then it follows up with the second theory course, which is the 7-50 course where you learn about the scrub nurse role. And then you can see that there's a connection that it follows up with a clinical piece, which is 7-50. And then you come back and do the theory for the circulating nurse role, and then go back into clinical to do 7-550, which is the circulating clinical piece. And then the very last clinical, 7-750, is where you consolidate both the scrub and circulating role. And then you can see that at the bottom that there's a perinatal pathway that I talked about for perinatal nurses who want to participate in cesarean section. So that pathway is a total of 10 credits that you would take, and it encompasses 2 theory courses and 1 clinical course. And then so for people who have finished our advanced certificate in perioperative nursing, they'll be able to work with patients ranging from all population ages, from infants to elderly. We have a variety of surgeries that they can participate in, day surgeries and even more complex surgeries. You can work in rural or tertiary facilities. And there's also opportunities for the operating room nurses who later on want to expand into being an RNFA, which is physician assisted surgery, where you're participating, where you can help facilitate surgery with the surgeon in that role, in the RNFA role. And then so here are some testimonial from previous or past students that have taken our courses. So here is Maggie. She comes from the island, and she had said that the BCIT Perioperative program has been an incredible guide to starting my new career as a perioperative nurse. And the next slide that we'll have just a few more testimonials from other students. So one student said, the BCIT Perioperative Nursing curriculum helped me to develop my knowledge and skills related to perioperative nursing. Next one is the course assignment was a great way to apply the Canadian perioperative nursing standards. And this helped me as I move forward into my practice. It will also be helpful in conversations about best practice and our standards with my colleagues. And the very last one is the course helped me plan and think of ideas during the scrub and circulating roles and what to anticipate during surgery. And finally, I think we have just my contact here. So yeah, feel free to reach out. You can contact me by phone, email, however. Thank you.